Did you know? Chronic kidney disease, or CKD, doesn't just pop up out of nowhere. It's often a slow buildup of issues over time. Things like high blood pressure, diabetes, and even certain medications can sneakily damage your kidneys. Today we will talk about what causes CKD and how you can protect your kidney health. CKD can be quite sneaky in its early stages, often showing no symptoms until it's advanced. Here are some signs and symptoms to watch for. Number 1. Fatigue. Feeling unusually tired, lacking energy, or experiencing difficulty concentrating can be early signs of CKD. Number 2. Swelling. Also called edema, this can occur in the legs, ankles, feet, face, or hands due to fluid retention. Number 3. Urinary changes. Changes in urination patterns, such as more frequent urination, especially at night, nocturia, or foamy urine due to protein leakage, can indicate kidney issues. Number 4. Blood in urine. Known as hematuria, this can sometimes be a sign of kidney damage. High blood pressure. Hypertension can be both a cause and a consequence of CKD. It's often a silent condition, so regular blood pressure checks are crucial. Number 5. Itching. Persistent itching, often worse at night, can be due to waste buildup in the blood from kidney dysfunction. High blood pressure, also known as hypertension, is closely linked to chronic kidney disease, CKD, in a complex relationship where each condition can exacerbate the other. High blood pressure is a leading cause of CKD. The elevated pressure in the blood vessels puts strain on the kidneys over time, leading to damage to the delicate filtering units in the kidneys known as nephrons. CKD, in turn, can exacerbate high blood pressure. As kidney function declines, the body retains more fluid and salt, leading to higher blood pressure. This creates a vicious cycle where kidney damage leads to higher blood pressure, which further damages the kidneys. Uncontrolled high blood pressure in CKD can accelerate kidney damage and increase the risk of complications such as cardiovascular disease, heart attacks, and strokes. It's a major risk factor for the progression of CKD to end-stage renal disease, ESRD, where kidney function is severely impaired and may require dialysis or kidney transplantation. CKD can mess with your blood pressure. Your kidneys help regulate blood pressure, so when they're not working right, it can lead to high blood pressure. And we know that high blood pressure is a major risk factor for heart disease. It can also mess with your body's balance of minerals like potassium and calcium. This imbalance can throw off your heart's rhythm, which isn't good news. CKD can actually cause or contribute to heart failure. See, when your kidneys aren't functioning well, they can't get rid of excess fluid and waste as effectively. This can lead to fluid buildup in your body, including around your heart. And that extra fluid around your heart can strain it, leading to heart failure over time. Managing high blood pressure is crucial in CKD management. This often involves lifestyle changes such as a healthy diet low in sodium and saturated fats, regular exercise, maintaining a healthy weight, limiting alcohol intake, and quitting smoking. Regular monitoring of blood pressure is essential for individuals with CKD. Target blood pressure goals may vary depending on the stage of CKD and the presence of other conditions like diabetes. You know how sometimes one thing can lead to another? Well, that's the deal with diabetes and obesity when it comes to CKD. Let me break it down. If you've got diabetes, especially if it's not well managed, it can really mess with your kidneys over time. The high sugar levels in your blood can damage the tiny blood vessels in your kidneys, making them less efficient at filtering waste. This can eventually lead to CKD if left unchecked. Carrying extra weight, especially around your belly, can put a strain on your kidneys. It's like they're working overtime to keep up with all that extra body mass. Plus, obesity often goes hand in hand with conditions like high blood pressure and diabetes, which we already know are bad news for your kidneys. Well, if you've got diabetes or you're carrying extra weight, it's super important to take care of your kidney health. That means keeping your blood sugar levels in check if you're diabetic and working on shedding those extra pounds if you're overweight. Infections can be troublemakers when it comes to chronic kidney disease, CKD. Some infections, like certain types of bacteria or viruses, can directly attack the kidneys. They can cause inflammation and damage to the kidney tissue, impairing their function over time. When your body fights off an infection, your immune system kicks into high gear. But sometimes, this immune response can be too intense, leading to inflammation not just in the infection site but also in other parts of the body, including the kidneys. Prolonged or severe inflammation can contribute to CKD development. Certain infections can indirectly lead to CKD by causing other health problems. For example, infections like urinary tract infections, UTIs, or kidney infections can result in kidney stones or scarring, which can affect kidney function in the long run. In some cases, chronic infections that persist over time can put a strain on the kidneys. For instance, chronic urinary tract infections or infections associated with conditions like HIV or hepatitis can contribute to kidney damage if not managed properly. Another causes of CKD is genetic disorder. Genetic disorders can play a significant role in causing chronic kidney disease, CKD, due to their impact on the structure and function of the kidneys. Some genetic disorders directly affect the kidneys from birth. These conditions, such as polycystic kidney disease, PKD, or Alport syndrome, can cause abnormalities in kidney structure or function. For example, in PKD, fluid-filled cysts develop in the kidneys over time, gradually impairing their ability to filter waste and maintain fluid balance. Certain genetic disorders can lead to metabolic imbalances that affect kidney function. For instance, conditions like Fabry disease or cystinosis can cause the buildup of specific substances in the kidneys, leading to damage over time. Some genetic disorders can affect the immune system's ability to regulate inflammation and immune responses. This can result in autoimmune conditions like lupus nephritis, where the immune system mistakenly attacks the kidneys, causing inflammation and damage. Genetic disorders can also interfere with the normal development of the kidneys before birth. This can lead to structural abnormalities or malformations that impact kidney function later in life. Another thing is that certain medications can potentially damage your kidneys, especially if used inappropriately, at high doses, or for prolonged periods. Common pain relievers like ibuprofen, naproxen, and aspirin. Prolonged or excessive use of NSAIDs can lead to kidney damage, particularly in individuals with pre-existing kidney issues or those who are dehydrated. Some antibiotics, especially when not properly dosed or monitored, can cause kidney damage. Examples include aminoglycosides like gentamicin and vancomycin, ACE inhibitors and ARBs. These are medications used to treat high blood pressure and certain heart conditions. While generally safe, they can sometimes cause a decline in kidney function, especially if there are underlying kidney problems or if the dosage is not adjusted correctly. Diuretics are medications that help remove excess fluid from the body, often used to treat conditions like high blood pressure or edema. However, some diuretics, especially loop diuretics like furosemide, can potentially harm the kidneys if not used cautiously. Smoking or using tobacco can have harmful effects on your kidneys, contributing to the development and progression of CKD. Smoking damages blood vessels throughout the body, including those in the kidneys. This can lead to reduced blood flow to the kidneys, impairing their ability to filter waste and maintain proper function. Smoking is a significant risk factor for high blood pressure, hypertension. High blood pressure can damage the small blood vessels in the kidneys over time, leading to CKD. Smoking accelerates the aging process of the kidneys. This means that even if you're relatively young, smoking can make your kidneys function as if they were much older, increasing the risk of CKD. Smoking triggers inflammation throughout the body, including in the kidneys. Chronic inflammation can contribute to kidney damage and the progression of CKD. Smoking is associated with an increased risk of developing diabetes and cardiovascular disease, both of which are major risk factors for CKD. Tobacco contains numerous toxic substances that can directly harm the kidneys. These toxins can interfere with kidney function and contribute to kidney damage over time. If you already have kidney disease, smoking can worsen the condition and accelerate its progression to more advanced stages. When kidney failure begins, it's often a gradual process with subtle symptoms that may not be immediately noticeable. Here's what typically happens as kidney failure starts to develop. Initially, the kidneys may start to lose their ability to filter waste and excess fluid from the blood as efficiently as they should. This decline in kidney function may progress slowly over months to years. In the early stages of kidney failure, you might experience mild symptoms such as fatigue, decreased urine output, changes in urination frequency, more or less frequent than usual, foamy or bubbly urine, and swelling in the hands, feet, or face due to fluid retention. As kidney function declines, electrolyte imbalances can occur. This can lead to symptoms like muscle cramps, weakness, irregular heartbeat, and changes in blood pressure. With reduced kidney function, waste products that would normally be eliminated in urine start to build up in the blood. This can cause symptoms such as nausea, vomiting, loss of appetite, metallic taste in the mouth, and itching. As kidney failure progresses, it can lead to complications such as anemia, low red blood cell count, bone disease due to imbalances in calcium and phosphorus levels, and cardiovascular problems like high blood pressure, fluid overload, and increased risk of heart disease. Eventually, if kidney function declines to a critical level where the kidneys can no longer adequately perform their functions, dialysis, artificial filtering of blood, or kidney transplantation may be necessary to sustain life. It's important to note that early detection and management of kidney disease can help slow down its progression and delay the onset of kidney failure. Regular checkups with a healthcare provider, monitoring kidney function through blood tests, and adopting a healthy lifestyle can all contribute to better kidney health. You can also check out my other video that talks about 11 fruits that cleanse your kidney fast. CKD. Did you find this video helpful? Please consider liking and subscribing to our channel for additional informative content. We appreciate your support very much.